What's up, everybody? How's everybody doing? I see Mark. Mark, it's been too long, man. How are you? How are you, Roel? I see you. Jack's here. What's going on? Great to see everybody. We're gonna let a few people come in. Welcome to the Performance Medicine Show. This is where we answer your health and wellness questions. I'm gonna make sure we're live everywhere. We're supposed to be live Facebook, YouTube, and Dr. Rogers LinkedIn. Hello, Carter. Welcome in. Thank you for hanging out. Bianca, thank you. Yes, this is actually brand new. We were hoping to, I guess, increase the depth. I'm not sure it worked, but we tried. We think it looks good. Great to see everybody. I see Mark's question there. Who's with us? We're going to go live with Dr. Rogers here in a second. If you have questions for Doc, go ahead and put those in the comments. He's going to be here shortly. For those who don't know, we send out Performance Weekly every single Tuesday. It's our weekly newsletter. It's basically a curation of our shows and our best content of the week. This week was a great one. If you guys remember, last week, Dr. Rogers did a Common Sense MD episode on mental illness. Is it a metabolic disorder? This was him going over the book Brain Energy by Dr. Christopher Palmer. Dr. Christopher Palmer has been on the Tim Ferriss show. He's been all over the place, kind of bringing to light a new way of thinking around mental illness. This week was on mitochondrial health. Super interesting. As I was listening to it, and guys, I have to tell you, if I can understand it, then you guys can understand it. And I finished up that podcast kind of understanding mitochondria and why it's important. And he goes over some supplements. One supplement he brought up is the Dr. Rogers Energy Complex. The reason for this is the CoQ10 and the PQQ. He can explain how that interacts with your mitochondria. In fact, I might, if I have it somewhere, there's a quote in there about what CoQ10 does and then what PQQ does and kind of why you need both. So super interesting episode. I encourage everybody to check that out at some point this week. And if you guys have questions about it, put them in the comments tonight. We're going to be talking about all this stuff. Aaron, I see your LDN question. I love it. Love the LDN questions. D-Len, what's going on? Barbara, hello. Linda, hello. Thank you. And Andy's birthday is tomorrow. His birthday's the 22nd. Today's the 21st. I'm going to head up there and get to hang out with him. Steve, my brother, what's going on, man? Great to see you. We had a couple, let's see, we put this in the weekly this week, telemedicine. This is an episode of Explain This with Robin Riddle, who is our nurse practitioner in the West Knoxville location, talking about telemedicine, how to basically schedule a telemedicine appointment, what it's like to be treated through telemedicine. We truly do believe that this is a big part of what we're going to be doing as we try to expand our reach. He talks a lot about how to do it with performance medicine. So if you guys have questions about that, let us know in the comments. We'd love to interact with you around telemedicine and what that looks like. And then we had Jill Henritzi, our nurse practitioner, our PA in the Bristol location, talking about osteoporosis. This was a throwback outside the box episode. But if you guys ever, were wanting to know how hormone therapy impacts osteoporosis for both men and women, this is the episode you need to watch. As you can see there, the birthday boys on your left. Andy hosts that episode of Outside the Box. So check those out, guys. And if you have questions for Doc tonight, go ahead and put them in the comments. I see, let's see here. We got a couple here so far. Terry, what's going on? Tracy, good evening to you. Is Doc ready to roll? I think he's ready to roll. All right, we're going to bring him in here. Dave, what's going on, man? That was like the best email. Thank you so much. You're the man, Dave. Thank you so much for being with us tonight. Coal miner's daughter, Amber, great to see you. It's only been, an hour and a half or so. I hope you guys had a wonderful day in the Fountain City location. Montana, hope you had a wonderful day in the West Knoxville location. Great to see everybody. Got a whole bunch of our team in here. We have a new addition to the team, which is going to be we're gonna bring that out here in a second. So stay tuned. What's going on, man?
We are. Oh yeah, at the end of the show, we have a surprise for you, don't we?
I know we've
Okay.
got a new addition, and
We have a surprise at the end of the show.
Yep. And you know what? I did
You'll
not
like it.
do. I did not run a poll. Because we said we are going to run a poll on the third cause of the epidemic, or sorry, the healthcare crisis in the U.S. And I did not run a poll on Facebook. I meant to, and didn't do it. So if you guys have a vote for the third cause of the Margo, what's going on? Great to see you. I'm in your office. I'm upstairs right now. If you guys have a guess or a thought, what was the question again, Doc?
Well, I think our current healthcare crisis, as you know, our country, with all the healthcare dollars we spend, ranks about 33rd in mortality rates and overall healthcare in the world. So we rank up there below a lot of third world countries. So I've always said that I think our two biggest healthcare problems are obesity and drug abuse, whether it's prescription or illicit drugs. I think a lot of our healthcare problems are from those two things, with obesity being number one. So I had a discussion with another doctor last week in Florida about the number three, what would come in third. He agreed with my top two. And so I have my own thoughts about it. And we thought we'd do a poll, which apparently you didn't do. But so maybe we'll just get it out there for next week. Or I'll tell you, my third one is mental health issues, I would say. Bianca says toxins. That's a good one. That's a really good one. That's one of those hidden things that isn't as apparent, but we do live in a very toxic world. There's no doubt about it. It causes all kinds of problems. And I think that's one reason obesity is number one, is because when you have a lot of fat, that's where your toxins are stored, in the fats. But highly processed foods, that's a great one. And
we're getting a couple.
I may do a podcast this coming week on something that I found out about today. I'll have to keep you in suspense on that, but remind me, Ben, because I really found something really cool from actually one of my patients that I'll have to tell you about. And I think I may do a podcast on it next week. Sedentary lifestyle, lack of exercise. I mean, that's way up there. This doctor that I was discussing this issue with in the hot tub down in Boca, he's from Boston, and he's actually a Harvard medical professor. And we had a good discussion about health. His number three was gun violence.
Interesting.
Of course, he lives, in a way bigger city. But so just interesting. I like to see what everybody thinks. Those are already some great ideas.
What do you think about Chuck's?
Lawyers. That's a great one. Chuck, I think I'm going to give you the prize on that one. Chuck, congratulations. Ben, send him a T-shirt or something.
We'll get Chuck something.
He's got to get a T-shirt.
We'll make that happen.
T-shirt for that. That just struck my funny bone, which I love. Nothing against lawyers. My brother is a lawyer and a judge,
Carter saying seed
Seed oil,
oils.
that's a
Yeah.
big one. I bet Mercola would agree with that.
D-Lim, wasteful spending.
Mhm.
Definitely.
Yeah,
A lot of
yeah.
great, yeah. I mean, so you're saying number one is obesity, number two is illicit drug use.
Well, drug use overall, whether prescription overuse or drug taking, I mean, that includes all the drug addicts, the fentanyl overdoses, and I mean, that's a wide topic. And so is mental health. Really, sometimes that bleeds into drug abuse bleeds into mental health, but there's a lot of mental health problems worsened by the COVID shutdowns, of course. But I mean, our young kids, it's unbelievable how many, if you look at the polling of these young kids, it's a hard time to be a kid. I think one out of every 4 or 5 kids has thought about suicide in the last 6 months. I mean, that's horrible.
And what's so interesting is, I was talking to mom actually yesterday about, just the importance of being around people and being, in community. Um, and I think, with, technology, I think we need to use technology to, be more together in a way. And I feel like, it's done the opposite so far, but we need to be around people. So I'm thankful for everyone in the comments interacting right now. Like I think this is a cool community, and hopefully, um, you know, can help with some of that stuff. But I'm saying, gosh, this is a great question by Sonia. Like Steve is saying, alcohol is a drug. Agreed. Um, Tracy saying all three are interconnected. Agreed.
They are. They are.
Super cool. Guys, so if y'all have thoughts on the third cause of the healthcare crisis, go ahead and put those in the comments. We'll be kind of interacting with that throughout. Thank y'all so much for being with us tonight on the Performance Medicine Show.
That is true, that the lawyer thing, because, it drives the cost of healthcare up because doctors practice defensively. They practice for fear of getting sued, so they order too many tests. They feel like they have to put everybody on every medication because if you don't have that diabetic on a statin, then they're going to ding you for some reason. I mean, there's all kinds of stupid rules out there, and fear of being sued. That's a major fear with any healthcare provider. So that a lot of times they practice defensively, and that's not a good way to practice medicine. You end up using too many medications and just looking at numbers and not really focusing on the overall health of your patient. But anyway, that's a subject for another time. But
well, we're going to keep talking about that, guys. We're going to get to the questions that came in throughout the week. Thank you in advance to everybody who either sent an email in with a question for Dr. Rogers or connected with us on Instagram or Facebook. I'm going to start. I'm going to start with this, but it's a fiber question, and I went ahead and I did talk to Lucas about this question, our nutrition coach out of the Johnson City location, and he gave me a great answer, and I'm interested to see kind of where you're at.
What Lucas say about it? That's a good question. That's a really good question.
Let me read this real quick. Okay, I know you love the hemp fiber, but hemp or psyllium, please explain this. Here it goes. When the soluble fiber gel-like substance slows digestion, thus limiting what is absorbed, which could help to lower cholesterol and regulate blood sugar levels, how does this also not limit absorption of the good nutrients that we want to absorb? I never really know the best time to take the fiber as to not interfere with absorption of the good stuff. So we get a lot of questions around absorption.
Great question.
And we talk a lot about the timing of when to take some of these supplements or in some cases medications. So I'm going to answer here what Lucas said. And here's what he texted me back. He said, fiber is a contradictory subject, as noted by the person's question. They seem intuitive. Based on my readings on fiber, it's been often recommended that your fiber-full meals be consumed last or taken after you finish your vitamin-rich foods. maybe 20 to 30 minutes after, so those nutrients have a head start before fiber takes over. If one wanted to slow absorption of bad things, one could consume fiber with or directly before. Reverse that for good things. Did you catch that? If
Yeah.
anybody's,
Yeah.
and then Lucas goes on to say, if I had to choose between hemp or psyllium, I'd choose hemp. It contains a mixture of both soluble and insoluble fiber, 20% soluble and 80% insoluble. It also contains healthy proteins and fats. Psyllium, is rather unpleasant when consumed and can cause gas and bloating in some. Long answer, but hopefully that helps. Thank you, Lucas, if you're watching. Thank you for shoot me that text. What's your thoughts? Do you need me to read any?
Yeah, no, that's a great question. Very, very good question, because we all probably don't eat enough fiber. Yeah, I like hemp fiber better because one thing, because it tastes better. Psyllium doesn't taste too good. Um, and they both have soluble and insoluble fiber in them. Hemp has more insoluble than soluble. I think psyllium has probably more soluble. So they're used for kind of different purposes. But the reason I like hemp, because it has a lot of omega-3s, tocopherols. It has more nutrients, really. If you just want a bulk former, maybe you want psyllium. But I think overall, I would rate the hemp. I think I did a podcast on this a long
Yeah.
time ago. I like the taste of it. I like to sprinkle it on foods. I think it mixes better. It has kind of a nutty taste, so I really like the taste of it. Psyllium just doesn't taste very good, and doesn't have all those omega-3s that the hemp does in it. Plus, hemp just sounds better. You're taking hemp. Uh, But so I prefer hemp, but the timing is important. The important point of this, because both of them are okay, but the timing, because you're right, it could delay the absorption of your nutrients and your vitamins, and maybe even some medication. So what I tell people is take your fiber um, at least an hour before you eat, or take medications, or 4 hours after you eat, because it can affect the absorption of some of the good stuff too. You're exactly right. That's a great point. So a lot of people will take it at night, when they're not taking anything else. They'll take it at night. So that's a good time, but an hour before, not closer than an hour before or 4 hours after you eat a nutritious meal or take your vitamins, because it definitely can affect the absorption of your nutrients. And yeah, I like what Lucas said about it too. It's timing is so important. And maybe if you want something to move through quicker, like junk food, maybe you take it with that. If you're eating something that you shouldn't be eating,
It's interesting.
maybe just pure starches or something like that. But what a great question. So
Great.
timing, and I prefer hemp, although some fibers are better than not enough, and we most of us don't get enough. Listen to your bowels. Some people get constipated, and soluble fibers mean that it's water soluble. Insoluble is not water soluble. You use the insoluble more to move things through.
Interesting.
And soluble, maybe if you have more gut problems, that type of thing. But they both can actually help reduce cholesterol as well. Whether or not you care about that or not, that's another matter. But because cholesterol is either being too absorbed or too produced by your liver. There's two different types of ways you can get high cholesterol. One is your liver cranks out too much. The other one is your gut absorbs too much. And that's one reason why these fibers can carry it through and not be absorbed. But great question. Timing. And I prefer the hemp personally.
All right. Thank you for that question that came in through email. Welcome in, Elena. So glad to have you in here tonight. Let's get to this question here. I have a multi-generational history of cancer in my family, and my doctor thinks I should have a Prenuvo scan run. What is a Prenuvo scan, and what does it show? What's your thoughts on this?
That is, I haven't heard it called Prenuvo, but I assume it's a whole body MRI, which they do it at different places. Insurance doesn't pay for it, but just a whole body MRI. I've had several patients go for that. Some they do it in Florida, they do it in Atlanta. There was a radiologist in Maryville, Tennessee, doing them, but you're gonna have to pay for them. But it's an MRI from your head down through your pelvis. So they're looking for things that you can't see and that may be occult, in other words, unseen and tiny. So besides the expense of it, a lot of times I'll see that there's some false positives and it'll lead to unnecessary workups because they kind of have to, when you're a radiologist, you have to kind of hedge a little bit, cover your butt on it for lawsuit problems. So it's not a bad idea. I think that they'll get better and more affordable as time goes on. I mean, I think we're going to be able to tell a lot of stuff through scans that whether it's an MRI or something else that just hasn't come up yet, that's quicker because, a whole body MRI scan takes a long time if you're laying in there. It's expensive. But say you had a brain tumor or, you had a lesion on your lung. Nowadays they have a low dose of radiation CAT scan that we use quite frequently as a lung cancer screener. So yeah, I mean, it'll probably be the thing at some point. It's just not there yet. It's expensive. It takes a long time. There's going to be some false negatives. It may scare you. So I don't think we're quite there yet for the masses. But certainly I'm not against you going and getting this done just to kind of maybe relieve your mind of it. We also, of course, have a few blood markers for cancers, and genetic testing is going to be big. So the future for sure.
Great question there. Thank you for sending that in. Welcome in, Jasmine, my Esty bestie, our esthetician in both Fountain City and the West Knoxville office. Let's get to a magnesium question here. What brands of taurate and krill omega-3s would you suggest? The prices and quality seem to be all over the place.
Yeah, especially with omega-3s, the quality's all over the place. My favorite omega-3 is made by Orthomolecular. That's the one I take and the one I recommend. The magnesium taurate, I think Life Extension may have one, which, I do like that brand of magnesium, especially for cognition. So I think about getting Life Extension magnesium. And I would go the Orthomolecular. That's my favorite krill, omega-3.
All right, great question there. And I'm going to put this up. Margot, who is our PA in the Fountain City location, is saying the Gallery test has been developed in the past few months that is supposed to test for almost 50 types of cancer by blood. However, the specificity and sensitivity, false positives and negatives, aren't perfect for each cancer type. Margot, thank you for putting that in there. Guys, as I always say, stay tuned in the comment section. We have a bunch of our team here tonight. So, and the community here, their thoughts and comments are just unbelievable. So stay tuned to the comments. Thank you for that, Margot. Let's get to a question about osteoporosis. We had an outside the box episode with Jill Henritzi, our PA in Bristol. If you did not look at that, check that out. But the question is, I am a 69-year-old female and just got a bone density test. The results showed osteoporosis, where 3 years ago was osteopenia. All the medicines have side effects and don't know what to take. I have not been taking calcium because it can also cause problems. Suggestions, please, dosages and brands. What's your thoughts on that? And maybe it's to check out that video with Jill. I'm
Yeah,
sure she
definitely
could
go to
throw-
Jill. Jill's our osteoporosis expert. You know, almost any woman over 50, certainly when you get to 60, you're going to have osteopenia, which really, they have a Z score and a T score on a bone density scan. And the T score is what we usually look at. And it's based on a 30-year-old's bones. So you're not going to have the bones of a 30-year-old. So almost everybody I get a bone scan back on has osteopenia. Now you cross over into, a T score of negative 2.5 or worse, and it crosses you over into more of a thinner bone osteoporosis, you're more at risk for fractures. The thing about the medicines is I don't like them either. I hardly ever use them because they cause so many side effects. I mean, I just, the old bisphosphonates like Fosamax, we used to put people on that, and it causes terrible heartburn, reflux. It can cause osteonecrosis of the jaw. It's just hard to tolerate. And besides, I don't think it builds the right kind of bone anyway. There is an injectable called Prolia that a lot of people recommend. At least it sides, you get it once every 6 months, and you're not going to get the GI effects with it. Certainly like you would the oral bisphosphonates. It is a form of bisphosphonate, but it's got its own set of side effects as well, including osteonecrosis. Maybe some of the side effects include increased risk of fractures in certain bones. So it's one of those things. I don't really like them. You also can have a lot of bone pain when you take the Prolia. I guess if it was really severe, I would consider it. And I've referred a few patients for that injection. But vertebral fractures can occur because of it. I'm a big fan of the old-fashioned stuff. I'm like you. You don't need to take extra calcium, really. We used to put everybody on 1,200 milligrams of calcium, and it just doesn't work. And too much calcium can cause effects too. Here's what I like to do. Number one, exercise, weight-bearing exercise. I like vitamin D with K. Remember to take vitamin K. That helps the D direct the calcium in your bones, not your joints or your arteries. And I like bioidentical hormones. To me, bioidentical hormones are just tremendous estrogen. That's why women have osteoporosis way more than men do, because they lose all their estrogen. So hormone replacement is my number one treatment for it. So I'm like you. I wouldn't get on one. They're expensive, have a lot of side effects. It'd have to be pretty severe. Again, if you have questions, please do a consult with Jill. All the orthopedic doctors send all their osteoporosis patients to her. Mm-hmm. And she's a good mix between, she knows all the traditional stuff, and she also knows all the integrative stuff that we do. So I guess it'd have to be pretty severe for me to put you on a medicine like you're talking about. And certainly I wouldn't take any extra calcium. That's another thing that like Prolia can do, is deplete your calcium. So you'd have to take extra calcium when you take that. But so that's kind of my 2 cents worth. So look at all the other stuff first and follow it and see if it's rapidly progressing. And hopefully it's not, if you're doing all the other stuff. Very good question.
That's a great question there, and I know a lot of people, are like you said, pretty much everybody over 60 has some form of osteopenia or has osteopenia?
Females, yeah.
Super interesting. Thank you so much for that question that came through email. Let's get to this one. We haven't talked about Freestyle Libres in a while. My Freestyle Libre says not to take high levels over 500 milligrams of vitamin C as it can affect the numbers. So would you recommend just leaving off vitamin C for 2 weeks? So what this question is about the 2-week, I guess, free trial for a lot of people doing this Freestyle Libre.
I never tell anybody that. I've read that before, but if you're just doing a 2-week kind of test of it, that's reasonable. Just cut your vitamin C out. It's not going to hurt you, or 500 milligrams instead of, a gram like I take every day. If you're sick, take more, but not a bad, I don't know why it affects it, to be honest with you, but I prescribed 2 of those today, and those things are so helpful. They really are. You're just going to get much better control, even for non-diabetics like me. I wore one just to see what different foods and drinks did to my blood sugars, and very surprising at what pops your sugar up.
So you're saying you're not advising anybody to do anything differently during that 2-week period?
No, I always say during that 2-week period, if it says that, go ahead and drop off if you're taking a higher dose C, just drop back to 500.
Let's see here. Okay, got it. Now this is from the same listener. Has to do again with the Freestyle Libre. It gets into some numbers here. Every morning, my alarm for low glucose has gone off between 3 and 5 a.m. with readings like 57, 65, 53, 54, when for the most part, all other readings have been in zone or close. Question is this a concern? As I know on the YouTube video, Andy said you don't want to drop below 60. This is referring to, I believe it was when you did a test run with Andy on the Freestyle Libre. Why would this be happening, and should I be concerned? For context, if they wait 3 to 5 minutes and check it again, it is back up to around 80.
I don't think it's a major concern. You're pretty close to 60. I don't know whether you're a diabetic, what medications you're on. A lot of that would make a difference. If I knew you're taking insulin at night, or, on an oral hypoglycemic medication, but you do some weird stuff in the middle of the night. The other thing is, some people have a little reactive hypoglycemia in the middle of the night. If you go to bed on an empty stomach, or if you consume carbohydrates before you go to bed, then you could wake up a little hypoglycemic because of, a hyperinsulin response. So it's kind of normal. But if you're not symptomatic from it, I don't know if it's waking you up. I know with, having 2 diabetic kids all these years, they would recognize a hypoglycemic episode and it would wake them up, and they'd know to eat something. Some diabetics don't, and we're mostly talking about type 1 that, are insulin dependent, of course, and a lot more brittle. I mean, gosh, their sugars would go from 550 to 25, in a matter of a couple hours. I've seen that happen. Of course, they're taking insulin and all. That's why the pumps are really good, and at night your pump's going to pump out less insulin than it is during the day because of that. But it's kind of a natural thing to drop down a little bit at night. But if you're not symptomatic and those are the numbers, I wouldn't be overly concerned. I really wouldn't. But look at, if you're taking a medication for diabetes, it may be a different matter. So you might want to even experiment with, if you're eating something before you go to bed, not eating, or if you're not eating, maybe getting a little protein to see if that would even the levels out just a little bit.
That is it.
Observation, though.
And this is, I want to put this in just because I know there's some people here who are considering doing the Freestyle Libre. I know you talk about it every day, so we're getting a little in depth here, which I like. 2 mornings, my level jumped to 151 and 171. Again, this is with the Freestyle Libre. First thing in the morning after a full night's fast, 6 p.m.
Yeah.
and nothing besides black coffee.
Yeah.
What would cause this? It quickly goes back to normal, but this seemed odd to me. I love this because I know I can just tell by your reaction that this is like something that a lot of people go through. What's your thoughts?
How can you tell? You see it in my eyes or
I
something?
I
What?
saw it. I
You
saw it.
did? You see
I
that?
could tell. I can
Yeah.
always tell.
You're very observant. You really are.
I can always tell when, like,
because I
you
can
know.
answer. I can answer this.
Yeah, I'm like, thank God he knows the answer.
It's embarrassing if I don't. Isn't it? Have to get Andy on here, Kelly. But yeah, that's called the dawn phenomena. It's a common thing, even though you haven't eaten anything, because your cortisol kind of gets revved up in the morning to wake you up. So it's really a cortisol thing. It's called the dawn phenomena. And the other thing, when you go the other way, it's called the Samoji effect. I guess named from a Japanese person. But anyway, it's kind of normal, and it's not a big concern that it pops up a little bit like that because of that cortisol release. It kind of wakes you up and gets you ready. And you may be a little overreactive, but boy, I found a lot of things that really affected my levels when I checked my Freestyle Libre. All kinds of stuff affected it. Here's Ike wants to get on the show already, but he's not
Come
ready.
on, Ike. Come on.
But that's a great observation. But no, I mean, I wouldn't freak out if it goes back to normal at all. It's kind of a normal phenomenon. Some people have a little bit more than others. Some of it may depend on how stressed you are, what the quality of sleep that you got, whether you have sleep apnea or not, which a lot of people have. But when I did my Freestyle Libre, mine jumped up too. I'm not a diabetic, but it wasn't unusual for me to jump up like that, 150, 160. But my A1C is good, and most of my readings are good. You're not going to be perfect on this thing. So don't freak out or anything. But that's look up dawn phenomena.
Yeah, I actually think
That's what it is.
I think we've done some content with Andy on the dawn phenomena. I'll have to try and find that. I'll send that. I've got the email, so I'll
I think
try and
Andy needs to do another little podcast on frequently asked questions concerning blood sugars.
Yeah, because I mean, when it jumps high like that, or when it dips down low, like it's easy to get concerned, and
Especially if it's waking you up.
Yeah.
I wish those things wouldn't alarm at that level. That's going to affect your sleep.
Great questions there. Thank you for sending those in and starting the conversation around the Freestyle Libre and blood sugar levels. It's so important. Okay, let me see if I can. Oh, here's one. I missed this from last week. I apologize in advance. Since different types of magnesium are best for different things, would it be smart to alternate 2 kinds every other day, or will one kind help somewhat with multiple things? An example is glycinate for bones and threonate for brain. Robin did an Explain This episode on all the different types of magnesium, and there's so many for so many different things. How do you counsel people with this? Because I know lots of people think this.
Yeah, I like the combination that has several in them. I think the threonate, life extension threonate is good. I think the Neuromag even has a couple of different types. If you're just constipated, go more for the mag citrate. But yeah, you're right. They have different advantages. That's why I like the combination magnesium supplements the best, unless you're just purely constipated. Because if you're like me and getting some age on you, you want that. You want bones, you want brain, you want bowels, you want. Magnesium also kind of protects you. The taurate is really good for heart, cardiovascular safety, prevents cardiac arrhythmias, etc. So if you can get a combination, and I'm certainly not against you taking, if you have some different types, alternating them. It's a good idea.
So you would alternate
Sure.
if you had different uses or different reasons for taking
Sure.
it, would
Yeah.
you so not on the same day though?
Well, you're getting too much magnesium if you start having diarrhea, then you have too
Oh,
much.
okay.
I usually don't recommend more than 500 or 600 a night, but certainly, you know, there are combinations out there.
But if you're taking 2 different types, you would take one on a Monday, the other on a Tuesday.
Probably if they're up there in dose. Yeah.
Okay. Cool. Super great questions that came in throughout the week. Thank you guys. We're going to go to the live comments. This is the section of the show where we answer questions live. So if you have a question for Dr. Rogers, please go ahead and put that in the comments. Thank you so much for all the people that are with us live. This is so cool. I'm going to put this up from Roel just because I just saw it. Would love for you to have a podcast on CPR basics or trans. Interesting.
Man,
Okay.
that is great. Okay.
Yeah.
Put that on the list, Ben. Awesome.
I'm writing that down because Roel, we talk a lot about like home medical kits, things that you need to have at home. So this is kind of right in line with that. So thank you.
Great. That's we will. It's good to
All right.
refresh that because you never know.
Let's see here. Let me see if I can find.
You ever been called upon to perform CPR, Ben?
To be completely honest, I have not. But I will say, do you remember that story with Andy? How I think he was still in PA school when there was somebody in a restaurant choking, and he went over and saved this person's life. And Andy was kind of looking around to see like, who saw that, and like he was kind of like amazed because he just saved somebody's life, and like nobody paid attention. The person that he did the Heimlich maneuver on just kind of went about their day.
Didn't even thank him.
Yeah.
Somebody saved Andy's life when he was a kid doing the Heimlich maneuver on him.
Really?
Mm-hmm. In Oak Ridge in the Taco Bell. Yeah, Andy will remember it.
I think I do
It was
remember that story.
my doctor friend's wife.
Really?
But yeah. I mean, I've had to do CPR several times on people, but outside of the hospital setting as well. We used to have to do it a lot in the hospital, but yeah, a lot of people, it's different these days. Most people recommend you don't breathe for them anymore. They actually will have a better chance of survival if you don't do mouth to mouth on them.
I really love this idea, Roa. That's great. I feel like everybody should know this. And I'm not pumped to say I need this podcast as much as anyone else. Let's get to Mark's question here on YouTube. Gut microbiota signaling to mitochondria has been shown to alter mitochondrial metabolism. Do you think a GI map would offer insight to mitochondria dysfunction and possible treatment? This has to do with the podcast episode today.
I do. For the last 2 weeks, I've done a deep dive on mitochondria, requiring me to fully digest 2 hard books, taking me back to biochemistry days. But it's important. And yeah, I certainly do think that that's exactly right. Your gut microbiome, meaning the bacteria in your gut, direct your metabolism. They can tell your DNA what to do, how to change, when to turn on and off. Your mitochondria, which has its own DNA, is certainly responsible not only for energy production, but also for epigenetics, the turning on and off of certain gene sequences that matter a lot to your health and well-being, because it's responsible for really cleaning out cellular debris, autophagy, programmed cellular death, apoptosis. But yeah, I mean, your gut microbiome is the start of everything, really. You have way more bacterial DNA in your gut that's not yours than you have your own DNA. So you're being directed by an outside force, which is kind of scary to think about. But, certainly It's really important. And I think the GI maps, one of the best ways we have right now of kind of sorting that out. Um, I always get a lot of good questions about that. I got one today that I'm gonna have to really do some deep thinking about. Had Klebsiella in their gut microbiome, and she had read somewhere where this is a physician. Starches can kind of interact with that and make your joints hurt more. So interesting stuff, complex stuff. But yes, I think that's definitely a good place to start, especially if you have a lot of gut dysfunction. And then definitely look at that GI map.
Well, and that's interesting that Mark brought that up because in the podcast, I don't think that you went over, some things you can do. You went over some consequences of mitochondrial dysfunction, but I don't think you went over like how would you know if you have mitochondrial dysfunction?
Well,
Other than
basically, you're tired.
okay, so just tired.
Well, there's a lot of markers for it, but certainly, in taking a deep dive in it, the microbiome plays a big part.
So the GI map might be like a really good test to see
Couldn't
how your
hurt.
mitochondria is doing. All right, Aaron's asking on YouTube, is LDN something you can go on long term? Will the body get used to it and doses need to be adjusted? Expand on long-term use of LDN, please. What's your thoughts
Yeah,
on this?
LDNs we just get such good reports on LDN helping all kinds of autoimmune inflammatory conditions. One thing about LDN, it's not going to work overnight. Give it time, at least a month. And yeah, I've just seen some just amazing things happen with low dose naltrexone. Very few people can't take it. I've had a few people that, were a little drowsy the next morning or didn't like the vivid dreams that you can have on it. In that case, I tell them to take it in the morning. But, you can definitely take it long term. Certainly not habit forming. But, what I usually tell people with most any medication that's going to be long term like that, whether it's a vitamin or a supplement like this, is give it 1 day a week off. Usually you're going to forget 1 day anyway, so it's going to work out by itself. But I haven't really had to keep going up on the dose really too much. I rarely use more than 4.5 milligrams. Sometimes I'll go a little higher, 6. I've used 8 in a couple cases, but it's definitely a long-term medication. But it's not a bad idea to take a break from it occasionally, or at least 1 day a week off, and kind of see how you feel, because you can get tolerant to anything. No doubt about it.
Great question there, Aaron. Let's get to Amber's question here on Facebook. I know you aren't supposed to take licorice root with high blood pressure, but what about, Amber, you did it. D-glycyrrhizine.
Boy, that's a tough one.
That's a tough one. That's a really tough word, Amber, so I apologize. But
yeah, I don't think that's, I'm not even going to attempt it. I can't say that one either. I don't want to get embarrassed. Say that real fast. That's a toughie.
Deglycerinated.
Yeah, if you take that, it's probably okay with that. Just check your blood pressure if you do that. I don't know that you're going to get the good effects of it with that form. I don't know. I don't use a lot of licorice. I know it's beneficial for a lot of things. I'd have to review some of my literature about it. I just don't use a lot of it. But I think that's fine. Just keep an eye on your blood pressure, because they are contraindicated in people with uncontrolled hypertension, the regular form of it.
All right, great question there, Amber. Thank you for putting that in. Let's get to, let's see here. Looking for a question from Sonia. Hi guys, Dr.
It's
Rogers.
on.
My Dr. Rogers, my nephew's wife was just diagnosed with alpha-gal syndrome. It took 2 years to diagnose her. Do you have any advice for her? Alpha-gal syndrome.
Yeah, I'm gonna have to review. I haven't seen anybody with that since medical school. And I'm trying to just rack my brain. Well, I'd be afraid to say anything, but I'll put that on. I'll try to get back with you, and because I just don't treat any patients with that, so I'll try to write that down for me, Ben, so I can contact Sonia with that and um, see who could actually give her some help on that.
All right, writing
Because
down alpha-gal syndrome. Okay. Cool. Sonia, we're going to get back to you on that one. Thank you for putting that in. Let's get to coal miner's daughter here on YouTube. What do you recommend for your narcoleptic patients?
narcolepsy is a condition. It's a sleep disorder where you just fall asleep when you're talking to somebody. You just have excessive daytime sleepiness. It can even cross over into shift worker syndrome also. My favorite medicine for it, number one, probably get a sleep study. But I like Provigil, Modafinil. That's my favorite for being alert. I also use that in ADD a lot of times too, but I love Modafinil. It's really good for being alert. A lot of the jet pilots take it before a mission. And it's really, I think it's the pill that movie Limitless was based on. Bradley Cooper movie. Remember that?
Yeah.
The smart pill. Some people
Yeah.
call it that. I have a
I
great
did.
example of a guy that, a patient, I tell this all the time, but he came up and saw me drove up a couple hours, and he definitely had narcolepsy. I put him on Modafinil, and he goes to the CVS in Knoxville to fill it, calls back, and he says, I can't afford $850 a month for this stuff. And now it's generic. It used to be prohibitively expensive, but it's generic now. So CVS was charging him $850 a month for that. So I start checking on things. So we went to GoodRx. You can get it for $35 a month at Food City. So that's how much of a ripoff they were doing on him. So shop around. I'm always telling people to shop around for their medicines. Pay cash for it. Go GoodRx. There's some other programs like that too, but some of these pharmacies are going to rip you off. I'm telling you, it's just they get involved in all these PBMs, pharmacy benefit managers, and it's just terrible. Even a generic medication, but I love Provigil. Wonderful medication.
All right. Thank you for that, coal miner's daughter. Let's get to Deb on Facebook. Thoughts on ABT Shingrix vaccine?
I think that's just thoughts about Shingrix. Yeah.
Okay.
I don't think that's
Sorry, Deb.
It's a two-step vaccine to prevent shingles. Shingles can be bad. We've seen some horrible shingles cases, so I'm certainly not against that vaccine. It's a two-shot deal. I took one 4 or 5 years ago, and I didn't feel too good. I felt terrible after I took it, so I never took the second one. So hopefully I have some protection. But, so I'm certainly not against it. I don't know, this whole vaccine question kind of, people aren't as trusting anymore about any of these vaccines. But certainly shingles can be bad. But the thing about shingles also, if you treat early, there's good treatments for shingles as well. But there's a fairly high incidence of shingles after you get to 50 years old. And certainly I've seen some pretty bad cases of it. And sometimes even if you treat it kind of early. So I'm not against it. Let's put it that way.
All right. Thank you for that, Deb. Let's see here. Let's see. Seeing a lot of great comments around the third cause of the healthcare crisis. Thank you guys. Let's see, where am I at? Just a comment from Barbara. I take the fiber when I first get up. Back to the fiber question, then take some of my vitamins after an hour or more, as you suggested. Cool.
Great. Good.
Sorry, guys. I'm trying to move as fast as I can. Here we go, Kathy. I was recently re-diagnosed with multiple myeloma and was advised by my oncologist to stop taking my BHRT. I have done that, but my symptoms are returning and I want to do the creams at least. Can I do that? Well, man, I'm so sorry to hear this, Kathy. What's your thoughts on this?
Yeah. I don't see why you shouldn't be back on it. One thing I've noticed about oncologists, as great as they are, they don't know much about hormone replacement therapy. So if they took a deep dive and got educated on it, they'd probably be all for you taking the, bioidentical hormones. They probably don't even know the difference between a bioidentical and a synthetic. So, if you came into me, I would put you back on it. Of course, I don't like to do anything that's against somebody being treated for any kind of cancer, because I don't want to get into, a tit for tat with the oncologist who's directing the treatment for that. But I just don't see the rationale behind it, to be honest with you. The creams aren't, and the pellets certainly, they don't have to be metabolized through your liver. They don't cause cancer. I'll tell you a great place for multiple myeloma. The center of the world is in Little Rock, Arkansas. There's several of my patients go there for their treatment. So if you have any questions, you may want to venture out to there. But I hope you go into another remission, and we'll put our prayers up there for you. But I don't know why they would tell you that, to be honest with you.
Kathy, we'll certainly be praying for you, and keep us posted on where you're at with that. Let's get to Chloe here. I'm trying to think, Chloe, spoke with your wife about my father-in-law having prostate cancer. Can you guide me to the YouTube video you have that is related to such a diagnosis? Trying to think what that would be with prostate cancer. Would that be?
I'm sure I've done them on prostates. And you might even want to go to our alternative cancer treatment.
Oh, maybe that was it.
It might be that.
Maybe, but I'm sure we've done something on prostate cancer. Chloe, we'll get you that video.
Yeah, we'll direct you to that. Those probably a couple videos on that. But gosh, there's a lot of choices and decisions to be made with prostate cancer. I tell people that have it, please don't freak out about it, because it's probably not going to kill you. Certainly there are more aggressive forms of prostate cancer. But I think as far as men are concerned, I think all of us are going to die with prostate cancer, not of it. But there's certainly there are more aggressive forms depending on the Gleason score. And, there's several different options for people as far as treatment of prostate cancer. Certainly after I decided on which traditional method I would go, I would definitely think about, and again, it depends on if you have metastatic prostate cancer or localized. Certainly I would think about some of the alternative follow-ups too, like artemisinin and fenbendazole, ketogenic diets, IV vitamin C, those things. I'd be doing all those if it was me. But great question. Please don't hesitate to reach out to us and maybe make a visit and look at all the different variables to your case.
And Chloe, I'll put that. I'm pretty sure I know what video it is. We'll put that.
Dan Bolton's video you might want to look at too. His wasn't prostate cancer, but
right.
He talks about a lot of different treatments for for all kinds of cancers.
I'm putting this up here from Barbara, just for the osteoporosis question. Exercise for osteoporosis was the answer for my mother, who lived to 97 years old, broke hip at 92. That's awesome. I completely agree. I think my grandmother, Mother Mary's in here, exercises every single day. I think that's right. I think exercise is crucial.
That's number one. That's number one.
Yep. Okay, let's get to some more questions here from D. Lynn. Is there a supplement instead of using hormones? Okay, I think this is for, is this for osteoporosis? I think it's just about hormones. Is there a supplement instead of using hormones? I went through menopause at 45. I'm now 64 and still have bad hot flashes.
Yeah.
My doctor won't put me on hormones. I took Prempro for a couple of years, and let's see if I might be messing this up, D-Lynn. I'm sorry. I think the question is this: is there a supplement?
Yeah, there's all kinds of supplements for, symptoms of menopause, like black cohosh, borage oil, evening primrose oil are the ones that come to mind. But yeah, you probably need to find a doctor who knows a lot about hormones, because if your mammograms are normal, unless you have active breast cancer, I don't know why they wouldn't. I certainly wouldn't put you on Prempro. Those are synthetic hormones. I mean, not because it's terrible. It's not, but there's just the bioidenticals are certainly safer. And I don't use oral hormones except for a bioidentical progesterone sometimes when I do a pellet. But yeah, I mean, you just need to talk to a doctor who's up with hormones, and most doctors just not. They're not trained in it, and they're going to poo-poo anything they don't know about. So you can do a phone consult with us if you want. I mean, I certainly wouldn't deny myself bioidentical hormones just because your doctor, for some reason, doesn't know much about them. Read the book All About Women's Hormones by Dr. Pam Smith. Maybe even give your doctor a copy of it. The doctors can get obstinate. They get obstinate and arrogant sometimes. And, I'm a healthy skeptic myself. I'm an open skeptic myself, but certainly, and you're not just taking hormones for hot flashes. Certainly it'll cure your hot flashes, but you're taking them to make your life better, for your brain, your bones, your skin, your hair, your libido, your energy levels, everything. I mean, just make sure you have a normal mammogram. And, even if you have a family history of breast cancer, that wouldn't stop me from putting you on hormone creams. You just have a doctor that, like most doctors, aren't familiar with it. And you probably shouldn't prescribe anything that you don't know anything about. You shouldn't. But at least say, hey, see a doctor who's an expert in this, who does a lot of this. So, we do a lot of telemedicine if you can't come into one of our offices. So read that book and make sure your mammogram's up to date and normal. But these hormones do not cause cancer, for one thing. They do not cause strokes. They do not cause heart disease. In fact, they prevent cancer, heart disease, and strokes. That's when you get cancer, heart disease, and strokes, when you don't have the hormones. You're getting old and brittle. So, again, when you don't have a doctor that's at least listening to you, then find another one.
I love that. Thank you, D-Lynn, for asking that question, because I think a lot of people have, these preconceived ideas around hormones, and they're hearing it from their doctors. So hopefully, shows like this, communities like this, we can help out with that. Okay, let's get to Rochelle's question, and then we'll get to the surprise. Doctor, I saw an interview of an 87-year-old young lady who swore by eating gelatin every day for her joints. She said no arthritis, no pain. Is that truly helpful? What's your thoughts?
I think it is helpful. There's a lot of good collagen in there. You can take some collagen extracts, or gelatin's a cheap way to get it. So yeah, I mean, it doesn't guarantee you're not going to have any pain as you get older. In her case, younger. But yeah, I'm all for it.
All right. And then we've got, Matt. I know why Matt's here. Bianca's wanting the same question answered.
Okay. It's 8:00. Let's bring Ike down. Some people call him Dr. Ike. I think Matt calls him Dr. Ike.
Dr. Ike. Dr. Ike's coming. If you guys have any last minute questions, put them in. If not, we're going to get to Dr. Ike and our surprise here. But man, that was a good show. How do you think we did?
That was a great show. I think you did great. I don't know how I did. Some of the questions I didn't know, but
honestly, I thought you knocked it out of the ballpark.
These things stimulate my brain, like the gal. I'm gonna really look into that one for Sonia. Okay, is Ike coming here first? Hang on. Let me get Ike in here first. Ike, come here. Ike wants to say hi because he's shy tonight for some reason. Here he is. Okay.
What's up, Ike?
Hey, what are you looking at me for weird? You're looking at me weird tonight because he has a guest. Ike. They call him Dr. Ike. Ike now has an assistant. He calls her Nurse Izzy.
There she is.
New addition here.
Look at that.
Izzy here. She's
Izzy.
A Bernedoodle like Ike. They're not related. They both came from Indiana in the same place, but they're not. They're not related. She's a lover girl. She loves me. She just loves me. But so they're not technically from the same mom and dad, but they're from the same amazing breeder. And she's just a cutie pie, isn't she?
Izzy,
I know you met her yesterday. We just got her yesterday.
Izzy is adorable. And my hope here is that Izzy's going to be a mainstay on the show, as is Dr. Ike. I'm seeing, Tracy's wanting them brought to the Kingsport office. Okay. I think let's see here.
She loves on me a lot more than Ike
does. loves both. I know you're partial to Ike too. So, Ike is not being ignored here, guys. Ike still gets his love. Tammy wants one. This
amazing. She's a person. Tammy wants one. I tell you, this little girl stole my heart. I love her to death. Yeah, I love her.
Look at that.
She's very affectionate. Also, she slept in a crate the whole night through, didn't make a peep. I slept right outside her crate, slept through the night. I was looking for a sleepless night last night, the first night she was here. But she was amazing.
Really? So Ike slept outside right beside her?
Right outside of her. They're already great friends. See, she's partial to me.
She is cute.
She's a doll.
I'll tell you what, Izzy, you're gonna be a star on this show.
I'll tell you one thing. Ike is jelly over though. Very jelly.
I'm sure he's jelly. Sippa here is jelly as well. That's Linda's pup. Sippa's jealous. We're gonna have a lot of jealous pups here. No, she's so cute. Izzy, we're so glad to have you here. So we got Ike and Izzy, guys. Ike and Izzy, they'll be back each week.
All right.
Pop, I think that's a show, man.
All right, Ben. Good show. Hope Andy has a good birthday tomorrow. I'll see you tomorrow for Andy's birthday celebration. And,
happy early birthday to my brother, Andy. He's in our Johnson City office. If you haven't seen him, he's an absolute rock star. I wish you all the best in this year. And Mark's saying he's got a long way till 40. He's still a young gun, man. Andy's a youngin'.
I need to go out and get him a present tonight. I still don't have his birthday present.
Well, go
at least going, a card,
Go get going. We got Jenny's birthday's here coming up. Mom is coming up on Monday, so we got a busy week. Guys, we love you. Thank y'all so much for hanging out with us every single Tuesday at 7 p.m. on YouTube, Facebook, and LinkedIn. As always, we will be back next week. Let's see. One thing, if you have not signed up for Performance Weekly, make sure you do that. It's on our website, performancemedicine.net. I've got my stuff I need to do here. So I think Chloe needs a YouTube title. We'll get that. Chuck, you're going to get some swag. Dad, do you know what swag means?
Yes, I do. It means clothing and accessories.
We're gonna get
I'm hip.
Chuck
Swag
some.
it.
I'll
Yeah,
make
get
sure
Chuck some swag for sure.
Montana.
'Cause that
Hold
was
me to
funny.
that.
That
We're
was
gonna get
funny.
that to Chuck. All right, guys. Love y'all. Love you guys. Thank y'all for
Bye.
bringing Izzy. There she is. There she is. My outro. Where are we at? Love you guys. See y'all next week. Love you, Pop. See you, man.
Love you.
Don't go away.